All right, great. Well, good afternoon, everyone, and thank you for joining us. My name is Dr. Matt Russell. I'm the Clinical Director of Geriatrics and the Medical Director of the Senior Health Clinic here at Massachusetts General Hospital. Thank you so much for joining us on this 1-year anniversary of this crazy world that we've been living in. I want to take I first acknowledge that we really appreciate you sticking with us and working, coming to these town hall meetings, telling your friends, and it's been an inspiration to us to really be able to bring this to you and also to continue to care for you throughout the pandemic. We have a really great update today on vaccination and all the questions that go with that. And then I'll talk about some things going on here in senior health. So with that in mind, I'm going to introduce you to our moderator for today, Susan Edgman-Levitan.
Hi, good afternoon. Thank you, Dr. Russell. I just want to add my welcome. We're always thrilled to see you. And I'm excited about today's discussion and just want to encourage you to ask any questions you might have using the chat function. So a few housekeeping rules. Everybody's muted so that we don't get any unexpected background noise. Including from all of us, our presenters. And I just want to go over a couple of the Zoom instructions. So you can view the speaker on your full screen, or you can go to the gallery view to see everyone. If you go up to the top right-hand corner, and you'll see a little set of squares that says view. And when you click on that, it will allow you to go back and forth from the gallery view, which is probably what most of you are seeing now, and the speaker view. You can also, if your picture becomes jumpy or out of sync, sometimes that's because your internet connection may not be really strong, and also because of the number of people on the call. So to do that, to try to fix that, if you go down to the bottom left-hand corner where you see a video camera, you can click on stop video, and we won't have the pleasure of seeing you anymore, but it might help your connection where you can see everyone else. If you have questions, please use the chat function, which is in the very bottom of the screen, right in the middle. And we encourage you to ask all of your questions, but I also just want to remind people that everything that you write in the chat can be seen by everyone on the call. So we really don't want you to put in any personal medical questions or medical information, because I don't think you want to share that with everyone else that's here today. But if you do have medical questions, please reach out to your doctor or the practice to get help. So we're covering a lot of information, but the town hall recording will be available afterwards, and we post these on the Senior Health website, on the Geriatrics and Palliative Care website, and you can also find them on the MGH YouTube channel, where we also actually have a lot of other information. And please feel free to share these with your friends and family. So with that, I want to get started and introduce our excellent speaker today, Dr. Rebecca Saff, who is from the MGH Allergy and Immunology Division, and she is the Fellowship Program Director for Allergy and Immunology. She's going to be with us for the first half hour, so when she is through with her presentation, we're going to actually open this up to your questions then, so we can take advantage of her expertise while she can be with us in person. And then we'll go back to Dr. Russell, and we'll continue to answer questions after he does a brief presentation. So with that, let's get started with Dr. Saff.
Great. Well, I have a few slides that hopefully will be helpful. And then, as I said, we'll answer some questions. So by now, we've all know the COVID-19 virus here, the SARS-CoV-2, and just emphasizing that all of these vaccines that we're talking about really are targeting this spike protein, which is on the surface of the virus and what it uses to bind into human cells to get in. And so by blocking that, we're hoping we can block infection, which is what we're seeing with these vaccines. So the two vaccines that we know well are the Pfizer vaccine and the Moderna vaccine. They're both mRNA vaccines. So just to remind you, the mRNA vaccines have the mRNA. So this is not DNA, this is mRNA. It never goes into the nucleus and it gets taken up by the muscle cells after it's injected. They translate it into proteins. Those spike proteins get put on the surface of the muscle cell and the immune system generates an immune response to it. You can get a lot of swelling, redness at the site of the injection. A lot of times people will feel feverish and fatigued and tired and achy, and that's all a normal part of your immune system being activated to generate a response to this virus. And so those aren't allergic symptoms. Those are simply just an unfortunate part of what your immune system needs to do to get a good immune response. And so it's not uncommon, particularly after that second dose, to feel kind of crummy for a day or two after you get it. And that really is all part of the immune response. Both of these vaccines are highly effective, so about 95% effective. They have this inactive ingredient, polyethylene glycol. That's the same thing as Go Lightly. If you've ever had a colonoscopy, or Miralax, if you've ever taken that for constipation, it's the same product. An allergy to that is extremely rare, but if you have an allergy to that, you should not get these vaccines. Both of these involve 2 doses, 3 weeks or 4 weeks apart, and then the one thing about the mRNA vaccines is that they have a lot of constraints in terms of storage, because that mRNA just isn't very stable. It breaks down pretty quickly. And so storage is an issue. They have to be kept quite cold. But they are very effective, as you can see, so they're really upwards of 95%. So the new vaccine we're excited to have is the Johnson & Johnson vaccine. So this is a different kind of vaccine. It works by using an adenovirus. Adenovirus is a pretty typical cold virus that you would get. This is an adenovirus that can't replicate, but it contains, again, the DNA for the spike protein. So all of these are targeting that spike protein. And this gets taken up by the muscle cells, and then actually goes into the nucleus, gets translated into the mRNA, and then that gets made into a protein and put on the surface. So a similar in the end way to generate an immune response. The advantage of this is that these adenoviral vectors are very stable, so you can store it for a lot longer at room temperature. The Johnson & Johnson vaccine only needs 1 dose, which is great. So just so you know, kind of how do we know whether a vaccine is good? We do these large clinical trials where we give people the vaccine versus placebo, so no vaccine, and then we compare how they do. And the Johnson & Johnson vaccine was done in multiple different countries: the United States, South Africa, Brazil, Chile, Argentina, Colombia, Peru, Mexico. It compared 22,000 people in each arm, and then they follow them forward to see how many people got the COVID-19 after they got this is a single dose, so the 1 dose of the vaccine, and the efficacy. So comparing the number of cases in the vaccinated group versus the number of cases in the placebo group was overall 66%. And we're going to talk a little bit about why that number. And then they saw a lot of the same things with the other vaccines: injection site pain, headache, fatigue, muscle aches, nausea, fever. There were a couple cases of hives related to the vaccine, and there's one possible case of anaphylaxis that's being investigated. But overall, it is a good vaccine with good efficacy. So one of the questions that's coming up over and over again is, which vaccine should I get? Are they effective? Are they differently effective? And then what about all of these variants that we're starting to see? Do they work against the variant? And I thought this was a nice kind of figure that compares them. So here's the Moderna vaccine. It's 94% effective. Pfizer was 95%. And this was done, those trials were done when we really didn't have circulating variants going on. And so we don't know specifically from the trials whether they would be more effective against the variants. But we do now have some data that shows that they're probably not as effective, particularly against this South African variant. B1351 is the name of it, but we can call it the South Africa variant. That's usually what it gets called. That one actually, probably it is less effective, but not effective. It is less effective. What we do have data for is the Johnson & Johnson vaccine. So 66% is what overall, but it depended kind of on which country you were vaccinated in. And so in the US, it was closer to 72%. And then if you look at the South Africa data, it was about 57%. So if you identified which strain people got, it was less effective. But again, not effective. It was just less effective. And it was still, and even though people got COVID-19 at a slightly higher rate, they were much less likely to be hospitalized, and there were no deaths in the trial from COVID-19. So that's a really good thing to know. So the variants are certainly there and circulating. In Florida now, they over 50% of what they've sequenced, those virus strains that are being passed are not the dominant strain that it was, but instead, particularly this B117 variant from the UK. And this is a comparison where they were looking at, kind of how effective. So we don't have good data saying in big trials how effective it is, but we can look at whether people make antibodies and how effective they are at what we call neutralizing. So binding up the virus and preventing it from binding. And you can see these are from the Pfizer vaccine when they go and they look against all these different variants. This is the South Africa variant. So it is less effective against the South Africa variant, but again, not effective, just less effective. This is the UK variant. It's seeming like it's probably still about the same. This is the Brazil variant, and it's probably maybe a little less, but about the same. So it's really the South Africa variant. Certainly we're seeing that it's less effective, but still has some good effect. So probably most of you are aware of where we are with our vaccination, but I just thought I would review it. So these are all the people who are now eligible for the vaccine. So people 75 and older, people 65 and older, and then people with two medical conditions. If you're below the age of 65, the Pfizer vaccine goes down to age 16, the Moderna to 18, and the Johnson & Johnson to 18. And then starting today, we're going to start vaccinating our childcare workers and teachers. And then these are the phase 2 eligible conditions. So if you're below 65, but you have two of these conditions, you would be eligible to register for the vaccine. And then the question comes up, well, what can I do now? So I'm fully vaccinated, which would mean 2 weeks after your second dose if you got the Pfizer or Moderna vaccine, or 2 weeks after the Johnson & Johnson vaccine. So if you're vaccinated and the people that you're with are vaccinated, you don't have to wear masks. You can have dinner together. That should be safe to do. If you're vaccinated and you're with a single family that isn't vaccinated, but a single kind of people group that are together, again, enjoy spending time with your family. If there's a high risk person that's unvaccinated, we are still recommending that you kind of take precautions, that you wear masks, you try to choose a well-ventilated area, you wash your hands, you try to stay 6 feet apart. Now that the weather's nice, meet outside. Or if you have multiple households who are not vaccinated meeting together, even if this household is vaccinated, the problem is now you have two unvaccinated households kind of mingling together. And so we worry about the risk. But overall, these vaccines are really effective. If you are fully vaccinated, you should be able to start enjoying spending time with family that you haven't seen, and getting together with other people that are vaccinated. And that's really all I have. See my messy computer. But I'm happy to answer any questions.
So thank you. That was really helpful. And I love the pictures on your slides. So I have a question, and that is, where are we seeing the South African variant in the United States?
So there's about 80 cases in 20 different places. So we're seeing kind of scattered cases. It's certainly not the dominant strain that's circulating right now. The worry, and if we can keep the transmission rate low, I think that that's a really good thing, because then we won't see it spread like this. So there have been cases across the country, though, of the South African variant.
Okay.
And then the UK variant is actually taking over as the dominant strain. I think it's about, depending on what area of the country you look at, but it's anywhere between, kind of 30 to more than 50% of the cases.
Okay. And so another question we have is, can you say a little bit more about high risk? And the having any one of the medical conditions, or do you need to have two? And I actually had a similar question because I saw that pregnancy is now on the list of conditions,
Mhm.
but I would imagine a lot of women who might be pregnant don't necessarily have one of the other conditions. So can you say a little bit about how that works?
Are you talking about how to get vaccinated, or in terms of getting together with people who are not vaccinated?
No, I think I'm talking about getting vaccinated.
So yeah, right now, unfortunately, if you only have one of those conditions, so for example, pregnancy in and of itself wouldn't be an indication for vaccination. But
Okay.
if you were pregnant and you had asthma, then you would be a candidate for vaccination. So those kind of things go together. And then when we talk about, kind of getting together and being careful about people that are high risk, we're talking about people who have those risks and those factors that we know make them at higher risk of a severe disease if they get sick, and being more cautious around them. Hopefully they're getting vaccinated.
Okay, and yes, and I was wrong. The question was really not so much about getting the vaccine, but it was about getting together with family. But I think you just addressed that.
Yeah.
So another question that has come in is about seeing if you're, and I'm assuming this is from someone who has been vaccinated, about getting together with grandkids who are not vaccinated.
Yep. So if you're fully vaccinated, and that means you've waited 2 weeks after your second dose, if for the mRNA vaccines, you should be good to get together. You should be safe to get together. One of the things that we're seeing is that even in people who have gotten COVID-19 after they've been vaccinated, that small group, that they don't get hospitalized and they don't die. They really have a much less severe disease, which is great. And so even, the efficacy says 95 out of 100 people that won't get the infection, but for those people that do, it's much less severe. And there actually have been in the trial, in the people that got, there were 0 deaths for people that had been vaccinated.
Okay, thank you. And I just got a message that I think my mic has been rubbing on something. So let me know if I just pulled it off so it wouldn't rub on my blouse. So let me know if it's okay. So we have another question about how soon after travel without vaccination, but negative PCR test, can one get vaccinated?
Anytime. There's no restriction on travel and vaccination. There is the couple of restrictions are if you've gotten a vaccine, we ask that you wait 14 days. So if you got, now we're kind of beyond the flu shot window, but if you got your flu shot or you got a shingles vaccine, you really need to wait 2 weeks. Or if you've gotten your first COVID vaccine, wait till you get your second, and then 2 weeks after that before you get vaccinated to something else. But there's no restrictions in terms of travel and coming back. We've had cases where people have gotten vaccinated and then unfortunately gotten COVID before they've been able to get their second vaccine. Then we wait till they fully recover, and then we can still go out and vaccinate them to hopefully boost their immunity.
Okay, and we have a question about when will young children be vaccinated? And I would actually make this a little broader in terms of when do you expect that we'll be moving on to people that where we don't have the either over 65 or 2 chronic conditions requirements?
Yeah, I mean, a lot of that has to do with just having the vaccine available. We would love to vaccinate everyone, honestly. But it's a lot about availability. It looks like by April, we're going to be more broadly vaccinating, hopefully, as long as we keep increasing the distribution. So I'm hoping that as we get into April, we'll get to the more broad vaccination. So the Pfizer vaccine is approved down to age 16. So we can currently vaccinate down to age 16. There have not been studies done, but they are currently ongoing down to age 12. So we're going to be able to hopefully vaccinate age 12 and up. We're hoping by the summer or the end of the summer. The vaccines in kids under 12 haven't been, the trials haven't, are just getting underway. So we probably are not going to be vaccinating people under 12. So that, we'll say,
Okay.
2 to 12 until probably, end of the year.
Okay. Another question, if you're fully vaccinated and your medical care provider is too, if you come in for an in-person office visit, do you still have to both wear face masks?
Yeah, in the hospital, we're taking the highest precautions that we can. So we are all still in the clinic, even though the staff is vaccinated, you're vaccinated, not all patients are vaccinated. So just the most cautious thing we can do is to make sure we keep you safe, and all the people around us. So we're still face masks, we wear eye protection or face shields to just make sure we keep everyone as safe as possible.
Okay, thank you. Another specific question is someone is flying to California 2 weeks after getting vaccinated. They're 76, and do they need to be tested before they fly and after they arrive in California?
So I don't know exactly what the rules are in California. So unfortunately, it's a state by state rule. Currently, states haven't changed their rules to take away the testing requirement regarding those people that are vaccinated. I hope they will in the future, but unfortunately, right now we just have to follow whatever the state rules are. And so, at least for Massachusetts, even if you are vaccinated, you still have to be tested until they lift that, and that's just a state requirement.
Okay. Any other questions? I don't see any other questions. Oh, someone has a, can you put it into the chat? I just saw someone raise their hand. You can't put it into the chat? Down at the middle of at the bottom of the screen, there's a little message thing that says chat underneath it. Okay, someone else has asked, and I'll see if we get the question. Someone else has asked, are there any other new CDC recommendations that people might be interested in?
I don't think so. So we are the biggest thing is the most recent ones are that they did talk about if people are fully vaccinated, getting together with other people that are fully vaccinated, that you don't have to wear masks, and that you can get together inside. There's some new recommendations about the Johnson & Johnson vaccine in terms of it doesn't have the polyethylene glycol, it has polysorbate 80, which is a really common preservative. It's in a lot of our vaccines, it's in a lot of our medications. And so it improves the solubility, and so it just makes these medicines better dissolve. It doesn't cause allergic reactions, or at least very, very rarely, and so it's much less of a concern.
Okay, and I think Dr. Russell just put in the CDC information into the chat. So if you see that and click on it, it'll take you to the CDC recommendations. So we have another question. When might someone who recovered from COVID, not hospitalized, but breathing difficulty when walking, when can this person get a vaccine and they're 80 plus years old?
So if you would be in the eligible group. The recommendations are you are fully recovered in, I think, 10 days, and then you're eligible for vaccination. You don't have to wait. We do think people who've had COVID-19 are protected for 90 days after their infection because of the immune response from the infection. And so you have the choice to delay if you wanted to, but you can be vaccinated right away.
Okay. And I think, Monique, I'm going to see if maybe you could unmute Maureen, because she has a question, and I think maybe can't put it into the chat.
I'm sorry.
That's okay. Go ahead.
Can you hear me?
Yes.
My question is, when you talk about a mixed group and you say if like there's two households and your household is vaccinated and the other two households are not, if you wear a mask, are you protecting because you're vaccinated the other people? In other words, are you doing this to help others? You're vaccinated, they're not. Are you wearing a mask to help others?
Yeah, so you yourself are probably protected and don't necessarily need to wear a mask, but the CDC recommendations still are. You're really doing it to protect the two households that are interacting with each other. We don't know who might be infected, and so we're trying to, it's this balance, which maybe we're not doing as good a job of talking about how, we want to get people interacting because that's so important. We want you to be able to see your family, but we still want to protect you. And so you being fully vaccinated, these are good vaccines. So if you are fully vaccinated and past that time, I think you can go interact with your grandkids, with your family, with friends, especially if they're fully vaccinated. But what we don't want are kind of multiple groups of people getting together, some of whom are vaccinated and some of whom are not, and that interaction leading to virus spread. Does that make sense? Yeah.
Okay. I actually have another question, and that is, if you are vaccinated, can you still be an asymptomatic carrier?
So we don't think so. So the way that the trials were done, they didn't test everyone every day. They tested people with symptoms. It was just kind of that's the way it was done. And so there's not any evidence that those people are asymptomatic carriers. But there's currently a bunch of studies ongoing, including at MGH, where they're actually making sure that so all these healthcare workers, there's thousands of people in the trial, they got swabbed every single week, symptoms or no symptoms, to make sure that they didn't have the virus. That data isn't out. But there's no reason to think that that would be true. So we don't
Okay.
know that specifically, but we think probably not.
Okay, and I think we have time for one last question. Someone is going to be flying into Massachusetts from another country, and hopefully with a negative PCR within 3 days prior to travel. Does this person need to get another PCR upon arrival? And I don't know whether they're vaccinated or not.
So I guess if I get to Massachusetts from another country, hopefully with a negative PCR within 3 days. If you've had it, my understanding is if you've had a negative PCR within 72 hours, you don't necessarily have to get another PCR upon arrival. But I would double check that. So it's within 72 hours, and Massachusetts says if you've gotten one within 72 hours before coming in, you should be good. If not, then you need to quarantine and get one within 72 hours of entering.
Okay, and they're not vaccinated. So, so I think we are at the end of your time, and I know you've got patients waiting to see you. So thank you so much for joining us today. And now we're gonna go to Dr. Russell. Thank you.
Thank you, Dr. Saff. It's always so great. I was asking her questions too, because having this great resource is just absolutely delightful. So thank you so much, and have a great rest of your day. She might have already left, did she? Yeah.
Yes. Did you get all your questions answered?
I did. I did.
Okay.
Yes. So again, I just wanted to talk about our senior health updates. So we are continuing to do in-person and virtual care as the virus is dying down. We're obviously going to be wanting to see people more in person, because that's just very helpful to complete the assessment. What we found in our practice in senior health is that virtual care is here to stay, and it's really helpful both for the family and for the provider. Like sometimes we just want to hop on the video without having to bring someone in and just have that conversation. So I think that will always be a function that we're just going to have. That's I hate to say it, silver lining of COVID, but it is one of the silver linings, is we have this other way of staying in touch and really just managing things quite well. We are certainly wanting to have the right balance between in-person and virtual. In other words, just all virtual all the time is probably not going to be satisfactory. To keep an eye out for things that can sometimes go wrong. But having that is going to be an ongoing discussion between patients and providers. The second thing I just want to talk about is we are still very much open and accepting of new primary care patients, as well as geriatric consultations. So if folks are looking to make a switch, they're saying, geez, I feel at this point I do want to have a geriatrician as my primary care provider, and you're over 70, then that's definitely something to reach out to us for. But some people have really good relationships and are very satisfied with their primary care doctor. And we love that because, we help primary care doctors all the time. And so what consultation is about is really, if you want to have a visit with a geriatrician and you say to your primary care doctor, listen, I'm getting older, I'm having trouble with managing my medications, or I'm having trouble with my memory, or I'm having trouble with falls. These are reasons why you can say, can I just have a geriatric assessment to make sure that we're covering all the bases? And I strongly recommend them, but they're, everybody tends to appreciate them because we do cover the whole slice of the pie of life and get a sense of how we can take these very seemingly low-tech solutions that can have a huge ripple effect on someone's quality of life in a good way. So let your friends know as well if you feel like there's someone who might benefit. Lastly, oh, sorry, not lastly, second to last, I have a very important announcement. And in the next few months, the Senior Health Clinic will be physically moving to the Yawkey building. So the Yawkey building is attached to the main physical plant of the Mass General Hospital. Senior Health is currently housed in the Charles River Plaza, which is a couple of blocks up from the main hospital. We are really excited about this move. One, it's a much nicer garage for those who drive. It is that much closer to the subway for those of us who take the subway. It is a much nicer space. It's on the second floor of the Yawkey building, which is an escalator ride up from the street and an elevator ride up from the parking garage. It's co-located in the building with orthopedics and cardiology and rheumatology. So all of the people we partner with very closely are going to be in the same building. So we don't have an exact timeline yet because it's going to depend on the COVID response units shutting down so that a domino effect of certain moves can take place. But I just keep an eye out for when you start to see things about geriatrics is moving, senior health is moving. We're also probably going to rebrand a little bit and just we're thinking about just calling it what it is, geriatrics, so that it's easier to answer the phone and there's no mistaking what it is. But open for feedback on that. The last thing I will say is we are having these town halls in response to COVID. I also think that these town halls are here to stay for patient outreach and education. And now more than ever, if you feel that there are topics that you would like us to start addressing that go beyond COVID, please start thinking about that and shoot us an email and let us know. At this point, I'd like to actually learn a little bit more about, fall risk reduction or bone health or nutrition, something along those lines. Just let us know. I think we'll always, until this pandemic is totally packed away, we'll always have, a COVID corner in these town halls where we talk about the latest and greatest. But God willing, with us all being vaccinated and things becoming more manageable, I don't want us to lose this really cool space of interacting with one another and learning from one another and teaching one another.